Welcome to iCare Central. In this video, we will understand the difference between lens subluxation and lens dislocation. For that, we need to understand what patellar fossa is. In this diagram, this is the lens and this is the vitreous body. The anterior part of the vitreous body has a depression which is known as the patellar fossa. Patellar fossa is occupied by the lens. It is also known as hyaloid fossa. Also, patellar fossa is not a separate anatomical structure. It is just a depression which is present on the anterior surface of the vitreous body. Sometimes the lens is absent from the patellar fossa, like in some cases where it could be seen floating in the vitreous cavity or it could be seen lying on the retina. Sometimes the lens falls anteriorly into the anterior chamber. So in all these cases, we can see that the lens is absent from the patellar fossa, and this situation is known as lens dislocation. When you will see this eye on the slit lamp, you will find that no part of the lens can be seen through a fully dilated pupil. This eye is aphakic. Another situation could be that the lens is partially displaced from the patellar fossa, which means that a part of the lens is out of the patellar fossa and a part of the lens is still present inside it. When you will see this eye on the slit lamp, you will notice an aphakic zone where the lens is absent and a phakic zone where the lens is present. This partial displacement of lens is known as lens subluxation. So to summarize, lens dislocation is complete absence of the lens from the patellar fossa, and lens subluxation is partial displacement of the lens where a part of the lens is still present inside the patellar fossa. This is an important viva question, and your homework is to find out all the causes of lens subluxation and lens dislocation. Please like and share this video if you found it useful, and please subscribe to my channel to support free education. Thank you very much.